Hi friends, Beth here from Senior Care Solutions. It's my second video, so I'm trying to build momentum here. If you could like and share at the end, I would greatly appreciate it. So today I wanted to talk about the difference between home care and home health. And I can't tell you how many people over my 20-year healthcare career, primarily in geriatric and senior care, have would call and ask for round the clock care in their home and expect that their health insurance was going to cover it. So I think this is a really important topic. So many people get those terms confused: home care, home health. So the primary difference is that home care is always going to be private unless you have paid for a long-term care insurance policy that specifically will pay for private duty nursing or private duty home care. Then you will have to pay out of pocket. But I used to really, when I would have deep conversations with families, either in their home, at their assisted living, bedside at a hospital, or a rehab facility, a lot of times I would say to them, look, staying home is great, but you have to build your team at home. And if you're not paying to live in assisted living, then the expense of having somebody come in is going to be worth it. If your goal will always be to stay home, then you either have to have children and grandchildren that can stop doing everything and take care of your needs at home, or you have to pay someone to come in. And I mean, honestly, there are a lot of different solutions out there, and between the two, your insurance covered services and some private duty care as well as family care can really maybe cover most of what you're going to need, unless your care needs are so high that you really do need more of a nursing component round the clock. Then you'd have to consider other options at that point. But home care is something that a lot of people, when they do start getting it, are thrilled, because a good home care agency is going to be bonded, licensed, insured. They're going to have a director of nursing that is going to be one of the first people to come out and put together an entire care plan, which is going to incorporate all of whatever is going to be the best way to assist the client. Some of the things that are offered under home care are companionship, of course, ambulation assistance. So it might be that someone's coming home with a rollator for the first time, which is a walker with wheels, or maybe they now are using a walker or a cane, any type of assisted device. They can do meal preparation, medication reminders, hydration reminders, personal hygiene care. I mean, soap, water, and somebody that doesn't have steady legs is not a good option. And so to have someone in the home that can assist you with that and make sure that you are getting all of your personal care needs met, as well as dressing and undressing, assisting with that if needed. Light housekeeping, transportation can sometimes be arranged. If the care provider or the caregiver coming in doesn't have a car, but the client is okay with that caregiver driving their vehicle, that's been arranged before. They can do laundry, change your bed linens. So there's a lot of different things they can do. Aside from that, they can do things like games, assist with technology. So if you wanted to have a weekly Zoom call, you could do that. You could have the care provider set up your computer or their phone so that you can see your family that live remotely. What other things? They can also help navigate other agencies that want to come in. So if you've received orders for home health at home, like maybe physical therapy is coming in, or a nurse visit, a nurse is coming in from an agency that's providing, say, wound care, that's covered. And I'm going into that in just a moment, but that would be covered under your health insurance. And they could help get those people in and out so that you're not getting up, so that the client or the patient is not getting up and down and worrying about who's knocking on the door and things like that. So those are some of the things that private duty nursing can do. It is considered non-medical. However, each client is usually overseen by a director of nursing from an agency. They're licensed through the state, so they are regulated, and that is private pay. So either you're going to come out of pocket for that, and I think the rates are somewhere between $29 and $39 per hour. If it's just companionship, of course, it'll be on the lower end. But if there's personal care needs, lifting, transferring, all of these other things, the more work that's needed, the more skilled the person is going to be that has to be in there, and the cost is going to reflect that. The other thing that's important, excuse me, is home health care. And what a lot of people don't know is that if you have a history of falls, or you have had, even if you're at home and you have a bad bout of the flu, you can have your doctor, your primary care doctor, write an order to have a nurse come in and see you. But you have to have the order written, and you have to submit it to a home health agency. Now, if you're at a hospital, you've had a fall, you went into the hospital and you were admitted, they can typically have someone contact you or refer an agency to call you to set up visits. So even if you had a surgery or anything like that, you're typically going to go home unless you agree to going to a rehab facility. If you're going home, you're going to want to have those services, have somebody come in and check your surgical site, or check on you, make sure that you're getting your strength back and that your therapy team is coming in. So those are some of the things that home health will cover. They'll cover physical therapy, occupational therapy, nurse visits. So that's more obviously of a medical need. So if you have wound care, or if you have, say that you need even hospice support or palliative support, which is usually pain management, then that's who would be coming in at that point under the home health moniker, under your health insurance. Now, some secondary insurances, if it's a managed care plan of Medicare, you'd have to have, that agency has to accept your insurance before they're going to send somebody out. So it's all predicated on whether or not, but if you've got straight Medicare, typically they'll write orders and have that agency come right out. Well, within a few days. The other thing that a lot of people are not aware of is that there are a number of primary care physician groups. They're primarily run by nurse practitioners. They could be certified nurse practitioners, even geriatric nurse care practitioners. And they are doing home care. They are doing home visits. So you could actually have your primary care physician come right to wouldn't be a physician, to be a nurse practitioner, coming to your home. They're all managed by an MD, and they are licensed and overseen by the state where you would live. So you'd have to Google that. You'd have to look it up. Primary care doctors who do home visits, and if they've got a web presence, they should pop up, and you should be able to make some phone calls. And if they can't, always ask, can you refer me to somebody that could come into the home, especially if you're homebound. A lot of times you have to be homebound specifically for primary care to come in and to be covered under Medicare. So that's basically the difference between the two. And sometimes, as you're building your team, you might only need home health for a short amount of time. But with home care, that might just whittle down. If you've had a hospital stay and you start out and you've got 8 hours a day, then, a couple weeks later, you might go just to 4 hours a day. So most agencies are very flexible because they want to work to the patient and the client's abilities. They want to meet them and allow them to continue to do the things that they can still do. But it's just a safety measure as you recover or as you age in place at home. Anyway, if you have any questions or specific comments, please put them in the comment section. And if you have any topics that you want me to talk about, I'm going to be rolling out an entire weekly different subject matters. So I would look forward to hearing anything that you'd like to hear about and tell you my experience with it. So thank you so much for watching, and I will see you at the next video. Bye.